Okay, well, welcome everybody. This is the UC Center Sacramento Speaker Series. I'm Richard Kravitz, Director here at UCCS, and a pleasure as always to welcome you here today. This is the sixth talk of the academic year, which continues with our 2020-21-22 theme of emerging from the pandemic, promoting health and prosperity for all Californians in the wake of COVID-19. I think most of you have probably been here before, but for those of you who are new, UCCS is essentially the university's mission outpost in Sacramento. We're a center that has two primary goals. First, to train up young people to participate more effectively in public policy and engage with democracy, and secondly, to share research-based knowledge with legislators and government officials in the interest of forming better public policy. So along these lines, we're now on to today's topic, which is curricular reforms and intergenerational health. Actually, infant health, but I've relabeled it intergenerational simply because we're looking at the effects of education in one generation on health outcome in the next. The content of school curricula and low birth weight might seem entirely unrelated, but as I think our speaker will show today, they're more related than you might think. And equally important, the work you're going to hear about today underscores an important point that's often lost, that policies enacted today can have effects years and even generations into the future, something that we want to forget, especially in relation to 2-year or 4-year election cycles. So Dr. Özkan Eren is Associate Professor of Economics at UC Riverside. He's also an affiliated faculty member at the Robert Presley Center of Crime and Justice Studies. He's a widely published economist who's examined relationships among education, health, and criminality, among other topics. He has active grants from the California Workforce Development Board and from the California Department of Corrections and Rehabilitation. And he's the winner of several teaching awards, including an award for undergraduate teaching at UC Riverside and also at Louisiana State, where he worked until 2018. Just a quick reminder about our format for questions. Please hold questions until the end. At that point, you can use the raised hand icon found at the bottom of Zoom, at which point we'll call on you and ask you to state your name and affiliation and then your succinct question, or you can type your question into chat if you prefer. So at this point now, please join me in welcoming Professor Eren as our speaker series speaker for today. Professor Eren.
Okay, hear me? Yes, okay, so thank you for having me. This is a joint work with Bahadur Dursun and me, Eugene. Bahadur recently moved to UK. He was a postdoc at Princeton, and me is an assistant professor at Ho Chi Minh University in Vietnam. Both Bahadur and me were my students in the grad school. For disclosure purposes, I would like to inform the audience that the paper is conditionally accepted for publication in the Review of Economics and Statistics. So this paper is about the importance of intergenerational transmission. We try to show that early interventions aiming to enhance the skills and abilities of youth may be important not only for them, but also for their offspring in the future. I would like to begin my talk by providing a few important statistics regarding poor infant health. Infant mortality rates in the US are more than 20 times higher for low birth babies than those of normal weight. 2/3 of all infant deaths were born premature. In addition to imminent health risks, a number of studies have shown that poor infant health persists into adulthood and adversely contributes to cognitive development, health in adulthood, and these large private and social costs of health at birth have attracted significant attention among policymakers and researchers as to what determines production of health. A variety of factors have been documented. The most prominent ones are access to medical care, parental economic well-being, genetic makeup, environmental factors, exposure to maternal stress, and maternal education. So among these determinants of child health, maternal education is going to be our focus in this study. So why should maternal education affect child health? From a theoretical perspective, maternal education is believed to affect child quality through multiple channels. First, education is known to promote health-enhancing behaviors. For example, educated individuals are more likely to be aware of adverse effects of smoking during pregnancy. Second, economic well-being translates into better health outcomes, and education is strongly associated with improved financial resources. Finally, parental educational monogamy may play an important role in producing favorable birth outcomes. So despite these theoretical predictions, empirical evidence regarding the intergenerational transmission of education on child health is mixed. A few studies find positive and causal effects of maternal education, while several others find no relationship between maternal education and health outcomes. This lack of consensus aside, existing studies generally measure mothers' human capital using years of schooling. So years of schooling is certainly a crucial parameter in understanding human capital dynamics. However, what a student does in school may be equally important. For example, in a published work, Goodman shows that math coursework in high school can explain a non-negligible fraction of the return to high school education. But quoting a well-known labor economist, one would hope that a year's worth of high school courses has value regardless of whether one requires an extra year to complete them. So our research question is in this paper is the causal effect of mothers' coursework in high school on infant health outcomes. We exploit staggered introduction of the changes in minimum course requirements for graduation across states in a difference and differences framework. We use confidential birth certificate information on all births in the United States for high school classes of 1982 to 1994. So before I dig deeper into the paper, I would like to give a preview of our findings. So we find that changes to minimum number of core courses required for graduation reduce the likelihood of low birth weight and prematurity by around 3.5% for Black mothers. The estimated effects of curriculum reforms for white mothers, on the other hand, are consistently smaller and generally insignificant. We also find suggestive evidence that the results were largely driven by math reforms. So as a result, curriculum reforms may have closed the black-white gap in infant health by around 3%. We propose improvements in maternal health behaviors, economic outcomes, as potential explanations for our findings. These improvements can be related to cognitive skill formation. In layman terms, in its simplest form, more math in high school translated into higher levels of cognitive skills, which in turn improved maternal health behaviors and economic outcomes, and consequently led to better birth outcomes. Finally, we find a total social gain of around $500 million driven by curriculum reforms. So what are curriculum reforms? So in 1981, the US Department of Education commissioned a study to investigate the quality of teaching and learning. After 2 years of intensive work, the commission issued a landmark report known as A Nation at Risk. So the report's assessment of the American education system was staggering. Problems range from dramatic declines observed over the last 2 decades in average scores on the SAT to rising demand for remedial education. The report also made important suggestions on how to improve public schools. The bulk of the recommendations were content-related and centered on adoption of rigorous curriculum standards. To be more precise, the report suggested that all students seeking a diploma be required to take 4 years of English, 3 years of math, 3 years of social studies, and a semester of computer science. A Nation at Risk, which is the report, is one of the few reports that galvanized media and public attention and prompted action. Several states reacted immediately by adopting curriculum reforms that changed the minimum number of core courses required to receive a high school diploma. So students starting high school 1 year would have course requirements that were entirely different than those for students who entered high school just a year before. And this will be our identification strategy. So that structure will be how we identify the effects of curriculum reforms. 40 states in different years introduce changes to the minimum number of courses required for high school diploma. Table A1 reports the state's year of reform along with reform subjects. For example, California increased the core requirements, math, science, social studies, and English, and the reform was implemented in 1983. So all the reforms for all states were introduced between 1980 and 1985. And if we look at the table overall, we can see that math was the pivotal subject of the reform. All 40 states implemented changes in math and some states in other subjects. For example, if we take Alabama, Alabama introduced the reforms in 1981, and math was the only relevant subject. So figure 1 plots the minimum number of courses required in each subject in the pre and post-reform periods. So the black bars denote pre-reform years and the red bars are post-reform years. For example, if we take math, the required number of math courses more than doubled in states adopting changes in math. Prior to the reform, the average number of courses required in math was 0.9, which is roughly equivalent to 1 year of study. Post-reform, that number increased to 2.21, which will be equivalent to 2 years of study in math. We observe similar increases in other subjects. So let me talk about data that we use in this study. The primary data come from the vital statistics natality records, which cover all births in the US from 1970 and onwards. So what this data includes is each birth certificate, and each birth certificate contains information about health at birth, as well as information on mother's state of birth, race, and mother's education. We also utilize data from the census and the American Community Survey in exploring the potential channels. We focus on high school cohorts graduating between 1982 and 1994 and concentrate on Black and white mothers given birth between ages 18 and 49. Our main outcomes of interest are low birth weight, defined as birth weight less than 2,500 grams, and prematurity, defined as gestational length less than 37 weeks. There are more than 3.7 and 16.7 million Black and white mothers in the effective sample. Table 1 presents the descriptive statistics for the selected pre and post reform control variables and birth outcomes. Panel B shows the fraction of low births, which is around 10% for Black mothers. The fraction of premature births is around 15%. You can see in the third and fourth columns, poor infant health outcomes were less prevalent for white mothers. Low birth weight is around 4%, and the fraction of premature births is about 3%. So this is our main estimation equation. So what we do here, we compare how infant health outcomes change for mothers exposed to reforms from their pre-adoption level relative to the outcome experienced by mothers whose state of high school attendance had not yet introduced reforms. So this is a difference and different setup, in other words. So Y is a birth outcome, such as low birth weight or prematurity. CR, which is our variable of interest, is an indicator that takes the value of 1 if mother's high school entry cohort was exposed to curriculum reform. X is a set of observable characteristics. And we, as part of the difference and differences specification, we also control for state and cohort fixed effects, and epsilon is the error term. So the key identifying assumption underlying this setup, this framework, is that trends in infant health outcomes, absent curriculum reforms, are similar across states. So to test this assumption, we also estimate a dynamic version of equation 1, which is given as equation 2, and that will be the event study setup, and the existence of any lag effects is likely to invalidate our identification strategy. And I'm going to show statistical evidence supporting our identification strategy. So prior to presenting the main results, I would like to briefly discuss the potential impacts of curriculum reforms on fertility behavior and composition of mothers. So the existence of such effects would complicate the interpretation of the results. It is not clear whether one can attribute the findings to genuine improvements in birth outcomes. So I'm not going to show those results, but fortunately, curriculum reforms were not associated with any changes in either on fertility behavior or compositional changes. What I mean by that, curriculum reforms did not have any effect on mothers' fertility decision. Similarly, curriculum reforms did not impact compositional variables such as mother's age at birth, marital status of the mother at birth, and child's gender. Once again, if I had seen an effect on fertility or any impact of curriculum reforms on composition of mothers, that will complicate the results, and it is not very clear whether I will be able to attribute the findings to genuine improvements in infant health. And we do not find an effect either on fertility or mother's characteristics at birth. So this is my main table for Black mothers. So the first column reports the estimated effect of curriculum reforms on the likelihood of low birth weight, and the second column shows the same results for prematurity. Both of the point estimates are negative and they are statistically significant, meaning that curriculum reforms reduce the likelihood of low birth weight and prematurity for Black mothers. These point estimates are multiplied by 100 for ease of interpretation. So how are we going to interpret these coefficient estimates? So we need to benchmark them with respect to pre-reform sample averages. And when we do that, the effect sizes translates into a 3.5% decrease in the incidence of low birth weight and prematurity. The next table reports the same set of results for white mothers. The first column is the effect of curriculum reforms on low birth weight. The second column is the effect of curriculum reforms on prematurity. And as we can see from the table, increases in the minimum number of core requirements for a high school diploma had no impact on infant health outcomes for white mothers. The coefficient estimates are not only small in magnitude, but they're also statistically insignificant. So taken together, the results from table 3 and table 4, these findings are consistent with reforms having their largest effects on those who ex ante had the least amount of coursework in core subjects. And that was actually the case. Black mothers had fewer, Black mothers had less preparation, had less math coursework preparation prior to the reform. So, as I have mentioned earlier, the validity of these results hinges on the parallel trend assumption. So, in other words, absent of reforms, the trends for infant health should be similar across the states. So these are the dynamic results for low birth weight, and these are the dynamic results for prematurity. I'm going to focus on prematurity results because visual evidence is more evident, although doesn't make too much of a difference if I interpret the low birth weight coefficient estimates. So in the left panel is for Black mothers and the right panel is for white mothers. In each panel, the negative numbers on the x-axis denote pre-reform cohorts. One would expect a null impact of the reform on unexposed cohorts. And as we can see in the panels, the point estimates on infant health outcomes for unexposed cohorts hover around the 0. And the divergence from 0 for post-reform cohorts is evident in the left panel, which means that reforms impacted Black mothers. The same reforms had no impact on white mothers. So to further support the validity of our results, we performed we did multiple falsification tests in the paper, but I'm going to focus the most intuitive one. So we know that curriculum reforms only pertain to high school students. Put differently, the reforms should not impact mothers whose educational attainment is less than high school. And reassuringly, we do not find any meaningful effect of reforms on infant health outcomes for mothers whose educational attainment is 8th grade or less. So what we are doing in this table, we are limiting the sample to mothers whose educational attainment is less than a high school. And given that the reforms only pertain to mothers with a high school degree, the reforms should have a zero impact on mothers whose education is less than a high school, is less than 9th grade. And again, reassuringly, we do not find any effect of the reform for Black and white mothers. The coefficient estimates do not exhibit a consistent pattern, and they are all statistically insignificant. So I think this is the most important. This is the most important part of the presentation. What we try to do here, we attempt to disentangle subject-specific reform effects. As I have noted earlier, math has been the pivotal subject of curriculum reforms. So to capture separate effects of math reforms from other subject reforms, we control for the total minimum number of courses required in other subjects. So the first row is going to be the impact of math reforms. The second row is going to be the impact of non-math reforms. In other words, the impact of other subject-specific reforms. The estimated effects of non-math reforms on infant health for Black mothers is small and significant, while the point estimates on math reform are statistically significant and large in magnitude for both low birth weight and prematurity. So what will be the main takeaway from this analysis? The main takeaway is that the impacts observed on infant health were largely driven by math reforms. We also investigate, okay, so now we know that the math reforms reduce the likelihood of prematurity and low birth weight for Black mothers. The next question, which is an equally important question, is what are the potential channels for our findings? So why do math reforms reduce the likelihood of poor infant health for Black mothers? To explore this, we consider 4 domains which are known to be associated with child quality. The first one is prenatal care utilization. Are Black mothers exposed to curriculum reforms? Do they utilize, are they more likely to utilize prenatal care? This is the first domain. The second domain is changes in health behaviors. The third domain is educational attainment. And the final one is economic outcomes. So let me repeat this one more time because this is important. We find that math reforms improve infant health outcomes for Black mothers. The question is why? So there are 4 potential domains we considered in the paper. The first one is the effect of math reforms may work through higher prenatal care utilization, may have worked through changes in health behaviors, which we proxy by smoking during pregnancy. The third domain is educational attainment. And the final one is economic outcomes, which we proxy by a weighted average of family income, receipt of public assistance, and labor force participation. In the paper, we showed that curriculum reforms had no impact on prenatal care utilization. Similarly, we also showed that there is no relationship between curriculum reforms and educational attainment. So our mechanism exercise lends support to changes in health behaviors, as we can see from the first column, which is proxied by smoking during pregnancy, and changes in economic outcomes, as we can see in the third column. So Black mothers exposed to curriculum reforms were less likely to smoke during pregnancy, and reforms appear to improve economic outcomes for Black mothers. The coefficient estimate for Black mothers is significant at 10% for smoking during pregnancy, and the coefficient estimate for economic outcomes is positive and statistically significant in the third column. So in the paper, so what will be the, takeaway from this table? In the paper, we argue that more math coursework in high school translated into higher levels of cognitive skills, which in turn improved maternal health behaviors and economic outcomes, and consequently led to better birth outcomes. So based on our findings, we also conducted a back of the envelope social gain calculation using only information from Black mothers. We find that 8,789 fewer infants were born premature as a result of curriculum reforms, and the annual social cost associated with prematurity was $51,600 per infant in 2005. Using these two numbers, we obtain a total social gain of around $568 million in 2017 values. And this is probably a lower bound estimate because we do not consider low birth weight infants in the cost calculation. Finally, we investigate the role of curriculum reforms in closing the Black-white gap in infant health. We estimate the following equation by pooling all Black and white mothers, and we find that the curriculum reforms may have closed the Black-white gap in infant health by around 3%. So once again, to conclude, this paper examines the impact of curriculum reforms on birth outcomes by exploiting the differences in the timing of curriculum adoption in a difference and differences framework. To the best of my knowledge, this is the first paper relating mother's coursework in school to child quality, and curriculum reforms appear to be effective in lowering the incidence of low birth weight and prematurity for Black mothers. And there is suggestive evidence of the effects driven by math reforms. And we propose to reduce smoking and improve economic outcomes as our potential mechanisms. So to sum up, I think there are two main takeaways from this study for policymakers. First, coursework in core subjects matters. Policies, as a result, policies designed to increase training in math and science can have lifelong consequences. Second, and probably more importantly, our findings highlight the importance of intergenerational transmission. Early interventions aiming to enhance the skills and abilities of youth from disadvantaged backgrounds may be important not only for them, but also for their offspring in the future. I think my time is up, so that will be the end of my presentation.
Thank you, Professor Aaron. We're going to go ahead and stop the recording now, please.